Hello, and welcome to the debut of Director's Desk, where we explore the groundbreaking work of the National Institute of Health and the people who are driving the innovation in biomedical research and public health. Today, I'm joined with the Principal Deputy Director of the NIH, my friend Matt Memoli. I'm absolutely honored to have you here, Matt. I know this is not your favorite thing to do podcasts, but I like them and you have to humor me, I think.
Yeah, hi Jay. It's good. It's good to be here with you. I made the long trip from down the hall to join you on this podcast.
Well, I thought today what we talk about is something that's really important for me, I know to you, and close to my heart, is the role that early career researchers and young researchers play in the scientific endeavor. And I know it's been something that's in the top of my mind because I've heard a lot of people in the scientific community expressing concern about the continuing support that the NIH has had for young researchers. And I wanted to just address that straight on. Why don't you start by telling us a little bit about how your career at the NIH? I know you spent quite a lot of time here. You were a young researcher once. Why is it so important for young researchers to be able to have the support they need to advance their careers?
Yeah, this is an extraordinarily important topic that I've considered, my whole career. But yeah, there was a time where I started here 20 years ago as a young researcher, right after my infectious disease fellowship that I did here, and I started in a lab. And as a physician, I really wanted to start a translational research project, meaning a project in which I could work in the hospital with patients as well as in the lab, not just in the lab. And I had to really try to find a way to do that. And there were honestly limited resources at the time for me to do that. So at the time, I just had to find a way and be very persistent, which meant going into the clinical center here at our hospital and consenting patients myself, collecting the samples, and so on. Yeah.
So what is that? So in other words, you had to convince a whole bunch of people who are older than you, probably more experienced than you, that you had a good idea.
Yes.
You had to, the clinical center, that's something that's unique actually, I think at the NIH. That's a hospital where people can run studies on patients who come and are cared for at the hospital.
Correct. It's a very unique hospital where all of the people in that hospital are research participants rather than just directly patients.
And so, I mean, that's a pretty expensive thing. Is it? But it's really important because it allows researchers to with great ideas from the lab, to directly interact and see if their ideas work out on people. But is it hard? Was it hard to get support for that when you were young?
Yeah, I mean, I was lucky that I was here as a clinical fellow, and so we were supported for to do research here and to try to do that. And because the clinical center is such a unique resource, it was available to me. The hard part wasn't getting access to the clinical center. It was getting the resources needed to run a clinical trial or a clinical study with the participants, because as one person alone, it's very difficult to do. Normally, people who do this have a team that includes nurses who are experts in research, research nurses, recruiters who can recruit the patients, and laboratory support staff who handle the samples after you collect them, things like blood, or in my case, I took samples from the nose of patients. And so when I started, I had to kind of play all of these roles alone. I was acting as the research nurse, as the person who went and got permission from the patient to enroll them. I was doing the lab work myself. So I was doing all the jobs alone.
But you had an idea that you wanted to test.
Correct. I had an idea, and I knew that if I was persistent enough, I could get it done.
The problem that I've seen, so I did research on early career researchers before I became NIH director. And this was a study that I did with my colleague Nico Pakalin, who's a professor at University of Waterloo. What we did is we looked at how new are the ideas that researchers are working on based on their published work. And we had a finding, which was actually kind of depressing for someone with white hair like me. It's that the newest, the time in people's careers when they're most likely to try out the newest ideas is when they're immediately after they finish their training. And then for every year of chronological age, the age of the ideas that they're publishing in their papers also ages by about a year. um, some of the best scientists, Nobel Prize winning scientists, you go back and look at their careers, for every 2 years that they age chronologically, the age of the ideas that they're working on ages by about a year. Right? So they're a little quicker or slower to like go off the bleeding edge, but it's really young researchers that are on the bleeding edge.
Yeah, well, I mean, I think that's absolutely true. If you look at most people's career, when you're starting out, you have ideas and you want to establish yourself in your field. And so you're willing to really push hard to try to do that and to try to investigate all those great ideas that you have. Once you are able to do that, once you achieve that and you become established in your field, you sort of establish yourself doing certain kinds of science, and it becomes comfortable, and you can stay there and make a career out of it. So it's there's not as much incentive to sort of push the envelope as when you're young.
And of course, we folks with gray hair still have a little bit of an important role. I mean, in that same research study, what I found was that that teams of researchers, early career researchers who had their great ideas, some of which may or may not work out, but if they're paired with a more senior researcher working together, they're the teams that are most likely to try out newer ideas.
Yeah, this is absolutely right, and this is really key. The role we can play once we become established is to support those young researchers and help them to become, the new leading researchers in our fields. And so what we really want, and I think what I've always said, and people who know me here have said, is that my role quickly became to help mentor and promote new researchers. And I had a number of other physicians who became researchers who came through my lab, and I've worked with them and supported them. And when they brought their ideas in, it really helped my work because we were able to incorporate sort of my ideas with their ideas, which made my work better.
Now I was a researcher outside the NIH when I was early career, unlike you. But the NIH played a really important role in my development as well. Right? When I was a student, I had support from an NIH grant aimed at pre-docs. Pre-docs meaning people who haven't yet earned their doctorate degree or medical degree. And just like you, I had the same experience of like my mentors putting up with my crazy ideas and letting me just try stuff out. I didn't have a lot of resources, but I could work hard and try to get piece together data sets and like write papers and see if my ideas actually worked. And it was a tremendously exciting time actually, because you can you don't necessarily know all of the pieces of everything, but you have an idea and you want to see if it works. It was really important to me to have NIH support for those at that stage in my career, so that I could actually give my ideas a shot.
Yeah, it's absolutely the most exciting time. I mean, I can tell you just a funny story. My first really large clinical trial happened. It started literally days after my daughter was born. So I was in the hospital with my wife. My daughter was born. We brought her home, and I ran over here to the clinical center to start that clinical trial. I can tell you, my wife never lets me forget.
I was going to say, maybe she hasn't. Hopefully, she'll forgive you now.
But it was really an exciting time.
Yeah.
Yeah.
Well, I think you can probably tell. I think it's really important that early career scientists have this kind of support. If you look through the history of the NIH, though, and not just the NIH, the biomedical scientific enterprise as a whole, what's happened over the past few decades is that there's been less and less support, I think, for early career investigators, despite policies adopted by the NIH to reverse the trend. Right. So if you looked, for instance, at the age at which early career investigators earn their first large grant, something called an R01 at the NIH. It doesn't matter what the thing, but it's a big grant. The big grant is a big deal for early career investigators because it says, look, the scientific community says, I'm an investigator worth supporting. I have an idea worth investigating, and gives me the resources to go out and build the team you were talking about earlier to test the idea. In the 1980s, the age at which researchers earned their first large grant was in the mid-30s. You'd be 35 years old. 35 just sounds like, that sounds old, I'm sure that some of our listeners, I hope at least there's some young people listening to us. But 35 is actually young for a researcher, right? Because it takes a while. You have to, you know, if you're an MD, you have to go through medical school. If you have a PhD, you have to go to graduate school. If you're doing both, you have to do both. Actually, I ended up doing that. And so that means you spend a lot of your 20s learning about the fields that you're researching, right? Because there's a lot to pick up just about what's known already. And then you have to have some time to like think, well what's missing? What are my ideas? Yeah, and how can I make a contribution to the field? And that takes some time. And so like by the time you're mid-30s, you think it's been a while, right? But it's actually still relatively young, right? In the 1980s, you could be in your mid-30s, and the typical age of someone earning a big grant was mid-30s. By the 2000 teens, it's the mid-40s. There's an extra 10 years that the previous generation of researchers didn't need to spend in order to earn the big grant. What that means is the capacity to actually try out the ideas that you have.
Yeah, and you know, even and once that happened, that set a sort of an expectation in young people that I think affected their desire to go into science, because to become established and get to a point, you know, where you're really considered successful was so long that they could find other things to do. And even in my own career, I've seen a lot of people who did get a PhD, did initially commit to science, walk away from actually really doing research as a long-term career because of this, and go into other things like consulting and other types of business.
Not that there's anything wrong with that.
Not that there's anything, no, there's nothing wrong with it, but in other words, they were taken away from a promising research career because of this limitation in terms of time.
I think it's so important for the scientific endeavor to succeed, to have the ideas of each generation to be allowed to be tested, right? To have and for scientists to wait decades before you can have your ideas tested, it just sort of saps your will to continue, I think.
Yeah.
And I think that's partly the situation we face, you know, even in the 2000 teens. The scientific research community has become, in a sense, it's a more daunting climb to be able to get to that point where you can test your ideas out than it once used to be. Like maybe when you and I were a bit younger.
Yeah, no, you're absolutely right, and we need to make going into a scientific career appealing, right? It has to be appealing. We're competing with all the other options people have. I know, especially in my own sort of field of translational and clinical research, we need MDs to go into this field. And MDs have already generally spent quite a long time in their education, getting a bachelor's degree, getting an MD for 4 years, doing some sort of residency, maybe a fellowship. I mean, you could be 10 years or more into your education by the time you're even starting in science. And then you have to deal with this, you know, when they can go and practice and make money immediately. So we have to make it appealing, because it really is a great career. It's exciting, it's fun. Really exciting. I mean, it's a blessing to be able to do this kind of work and
you
investigate your ideas.
And not only you can test your ideas out, but the ideas that you have, they have the opportunity of making the lives of other people better, right? Like in the mission of the NIH is an amazing thing. Like we get to do research that if things go right, we improve the health and longevity of Americans and actually of everyone.
That's absolutely right. I had a professor in college at William & Mary who, when I was talking to him about trying to go to medical school, he told me, he said, well, you can be a doctor and you can help, you know, maybe 1,000 or so people or more as a practicing physician, but you could help millions of people as a researcher and a scientist, going on, you know, after you're dead even. Yeah. So, I mean, it really is a great career if you can commit to it.
Yeah. Okay, so I want to talk a little bit about the challenges that we faced I've been director of the NIH for about two months, and I keep hearing from the scientific community that somehow that we have stopped supporting early career researchers. I want to I just want to one of the reasons I was so thrilled to have this podcast go is I wanted to tell young researchers in the scientific community that is absolutely not true. That we are at the NIH 100% committed to making sure that early career researchers get the resources they need for the training that they're having, and so that they can become excellent scientists. I just it's been a challenging time because I mean, even before I got in, you were the acting director. There's been a lot of disruptions in some of the training programs and things like that. Let's talk us through like what's gone on and how we've started to address some of these problems.
Sure. Well, yeah, it's kind of funny. We've both been director. I was director for about the same amount of time. You've now
That's
been
true,
director, which is kind of funny. So yeah, obviously we've gone through a transition. This is the first big change at NIH in terms of leadership in about 16 years, really, and we're trying to refocus, evaluate, and plan for the future, and that means taking a hard look at what we've been doing and making decisions to try to advance our scientific mission to benefit the health of the American people to the maximum it can be. And so in doing that, there's some slowdown. There's some in the normal process, and there's efforts that can affect what's happened. But I think that when we're through this period of transition, things are going to be even better and really very promising for young scientists in particular. I mean, I know you're focused on this. I'm focused on this. Everyone we talk to here at NIH who works here wants to support young science. I mean, I think everyone's in agreement on this. We're all going to get behind this initiative and really work to do that. And the programs that did exist, they're still going to exist, and they still do.
Yeah.
And it's just going to, just been a little bit of a time lag in getting the message out and getting things going.
Yeah, and partly what I've seen is that there's been a lot of anxiety over the transition. Like you have a new administration. Well, just to be frank, a lot of the scientists who are here and in the scientific community broadly in the United States don't necessarily support the current president, and so they're nervous. But the current president picked scientists to run this institution who love science, who have support for, and I can tell you from personally, I've heard nothing but support in that sense. The shift in the training programs, they've been training program. The key thing is to realize is that what we were doing before wasn't working actually. What we were doing before, despite the commitment that the NIH would say to support young scientists, nevertheless, scientists were taking longer and longer and longer to be able to get large grants, right? And so it really is time to do something different, to rethink. I want to address one other topic related to this before we close out. Some of the training grants, one of the big initiatives has been to remove sort of political ideology from the NIH portfolio. I think that's important. We'll have a future podcast where we talk about that in more detail. And I think just briefly, I think it's important to do that because I want the NIH is inherently a non-political organization. Right? It's supposed to be non-political. The mission is non-political. There's no such thing as democratic science or Republican science. There's just science. And there's no such thing as democratic health and Republican health. There's just health. Mm-hmm. And the mission of the NIH is to support research that advances the health and well-being of everybody. Minorities, literally everybody, children, poor people, everybody. But some of the programs that we had at the NIH had elements of it that were not just aimed at improving the health of everybody, including minority populations, but were ideological. And some of the training programs that we had this sort of ideological component to them. Mm-hmm. How would you think about that? Now, there's been disruptions of some of those, but the goal is to reestablish the training programs, the support for young people, so that it removes some of this ideological component, but still nevertheless maintains the support for every excellent scientist, no matter who they are.
That's right. Our goal is to support young scientists from all communities around the entire country of the United States no matter who they are, where they come from. If they're excellent scientists who can do meritorious work, we're going to be behind them, and that's what we want to do. We want we want to support the new leaders of science that we will see, that will come from all walks of life in this country.
So what? Okay, so let's just be concrete. What will success look like at the end of this? At the end of this process? I mean, it's been a disruptive time, of course. I've heard it from so many people.
Yeah.
But the disruptions are not going to last forever.
That's right. That's right. In fact, I expect that when the disruptions are over, NIH will be a much more efficient place where scientists can apply to do research and get funded in a much more sort of easier way or more streamlined way. We are putting together working groups right now to think about ways to clean up the application process, improve the review process, improve the way we announce research, and even try to allow scientists to have more freedom to apply for their ideas rather than us dictating what they're doing. Them coming to us from the community saying, these are the things we think are important. I mean, we're trying to do that now. It's going to take time, though. It's not simple. And as you pointed out earlier, we've had this long-standing system. When you have a place that's been doing something a certain way for a long time, especially in the government, it takes some time to change it.
Yeah. But I think the long run is that we are going to make sure that early career scientists have the capacity to get the training they need to devote themselves to a scientific career, that they can test their ideas out. They don't have to spend decades before they have any chance of getting their long R01, first large grant.
Absolutely. And if I could put even another pitch in, here in the intramural program, which is the program here on the Bethesda campus, where scientists work here doing science in labs in the clinical center, we need young scientists to come here. We have an aging community of scientists who are great and wonderful, but many of them are ready to retire, and they will retire, and we need new scientists to come in. We have a clinical center that is ready to have clinical trials, and we're not near at capacity. We want young scientists, young physicians to come here, join our fellowships, join our research programs, and become the scientists of the future here at NIH, so that we can fill up that hospital doing great research that's going to help the American people.
Yeah. I mean, there's a physicist, Max Planck, who had a very famous saying, which is that science advances one obituary at a time. I want to make sure that that's not actually true. We don't need to have that happen. You can have the older scientists, of course, they have wisdom, they have knowledge, that then they've a lot of accomplishments. But we have to enable the early career scientists to have their day, and that's going to be a major priority for me, and I know my major priority for you going forward and for the NIH. I mean, this is probably the most important thing we will do as far as our legacy is concerned, to make sure that the next generation of scientists have the support they need to do the work that they're capable of doing.
Yeah, and that they can do that work unencumbered from political ideology and other issues that can get in the way.
Yeah. Well, thank you for joining me today. It has been a real pleasure to talk to you, Matt. And to our listeners, thank you for tuning in. Drop your comments in the chat as to what subjects we should cover in coming weeks. I intend to have we'll do this as soon as we start to get topics we want to hit, probably more frequently to start. Be sure to hit the like button and subscribe button on your preferred podcast platforms. Until next time, I'm Dr. J. Bhattacharya, and this has been the Director's Desk, and thank you for listening.